All right, well, it is noon, so we are going to go ahead and get started. I would like to welcome everyone to Wednesday Wellness, a free live educational series presented by Trinity Health Medical Group. Thank you for joining us this afternoon. Before we turn it over to our presenters, we would like to provide a few reminders. This presentation is being recorded, and you will receive a link to the recording over the next few days. If you have questions, please use the Q&A chat, which is located near the bottom of your screen. Your questions will be read aloud and then answered by our presenters. Without further ado, we would like to introduce our presenters for the afternoon. Carrie Mull is the Administrative Director of Behavioral Health for Trinity Health West Michigan. Carrie has more than 29 years of experience in behavioral health care. She is a psychiatric nurse who has worked with individuals with mental illness in the inpatient and outpatient setting. Carrie has a passion for eliminating the stigma that is often associated with mental illness and has spent most of her career working to decrease barriers for individuals attempting to access mental health care. Our other presenter this afternoon is Susan Blackburn. Susan is the Ambulatory Clinical Services Manager with Trinity Health Medical Group, West Michigan. She manages a team of addictionologists, psychiatrists, social workers, and nurses who provide embedded behavioral health, outpatient therapy, and psychiatry and recovery medicine services. Susan also has more than 29 years of experience in the clinical social work arena, including child welfare, outpatient, and medical settings. Susan has direct and managerial experience collaborating with patients on a continuum of services, including integrated behavioral health, outpatient mental health, and substance use disorder, and in-home program. Welcome, ladies. Thank you so much for being here today.
Good afternoon, everybody. So depression and anxiety, is this really a big deal? So according to an article by all1health.com, nearly a quarter of Americans reported feeling extreme stress come holiday time. Moreover, the American Psychological Association says that 69% of people feel stressed by having a lack of time and a lack of money, and 51% are stressed out about the pressures to give or get gifts. 8 in 10 Americans say that the expectations and events around the holidays cause them to feel increased stress, and nearly 3 in 10 say they get less sleep. And finally, a NAMI study showed that 64% of people with mental illness report holidays make their conditions worse. So holiday depression and anxiety, what might that look like? So some of the mental health symptoms could be nervousness, panic attacks, hard to find joy in anything, increased alcohol or drug use, mood changes or irritability, short temper, anger outbursts, having a hard time shutting off your mind, difficulty focusing, and trouble sleeping. Some of the physical health symptoms of holiday anxiety could include fatigue, loss of appetite and undereating, or increase in appetite and overeating, that's stress eating, headaches, stomach issues, aching all over, and poor work performance. The most wonderful time of the year, is it? Well, I'm going to spare you all on my singing voice, but listen to this. With kids jingle belling and everyone telling you to be of good cheer, it's the most wonderful time of the year? Perhaps, or perhaps not. So some of the potential holiday stressors that we may be experiencing include family drama, challenging relationships, loss. So coming together with family can be a trigger or a reminder that people that used to be with us aren't here anymore. And then there's travel, pressure to travel, cost of travel, traveling with children, delays or complications, getting stuck in an airport for many, many hours. And then there's managing the expectations of others, the gift buying and sending, cooking, baking, and all those other things that go with that. So we're trying to do it all. This can be overwhelming, which can lead to poor sleep. And all this impacts our mood. And people feel bogged down by the feeling of the need to be perfect. And there's that gingerbread man in his house is just destroyed. We don't need to feel perfect. So we have a technical difficulty with our videos. So this is Nora Crank from Christmas with the Cranks. And the gist of it is Nora's trying to get a ham because her daughter's coming home for the holidays. And there's one ham left in the grocery store. And she's climbing over a cart and fighting a woman for a ham. This is a typical scenario in grocery stores across America right now. So on your own time, look that video up. It's super funny. So how do we get away from comparing ourselves to others? So think about this constant reminders from all around. There's real life and social media. Videos and pictures on social media sites. Remember, you're seeing people's highlight reels, not necessarily reality or the true picture of their life. Sometimes social media and making those comparisons can just make us feel bad about ourselves. So this person's definitely going to have a high electricity bill come January, but it's a perfect example of look at my story of my perfect house with my illuminations. Impossible expectations, the perfect meal, the perfect table, the perfect gifts. Look at those wrapped so nicely. And again, with our technical difficulties. So this is from Christmas Vacation, where Clark Griswold and the family have gone out to find the perfect Christmas tree. And they bring it back. And as you recall, there's this beam of light coming down from the skies above. He hauls it into his Christmas setting into the living room, and he opens it up and takes out half the windows, and it's huge. Impossible expectations. Don't be Clark Griswold. But what can we do? There are options.
Awesome. Thank you, Susan. So Susan talked to us a little bit about what might depression and anxiety throughout the holidays look like, some of the symptoms, some of the statistics. But now we need to talk about what in the world to do about it. It's one thing to know what that might look like and feel like, but now we need to come up with a plan. So I'm going to talk to you a little bit about some of the coping strategies and some of the things that you might consider doing to help you get through this potentially difficult time. So first of all, normalize the feelings. And I say this because sometimes when you feel like how Susan described, you feel like you might be all alone. And I first want to say rule number one, this is my rule number one, do not panic, okay? It is normal to feel stressed and anxious and sometimes downright depressed throughout the holidays. It's okay to feel sadness and grief. But then at the same time, let's put together an action plan together so that you can start to feel better. That said, I want to talk about if those symptoms of depression and anxiety aren't going away after the holidays, if they're just persisting, you might have what's called seasonal affective disorder, or SAD, is what sometimes people refer to that as. And it's quite common in states like Michigan, where we don't have a lot of sun throughout the winter. So if your symptoms are not getting any better, you must get help. Talk to your physician or your nurse practitioner or physician assistant about a referral to get you to treatment or counseling. And honestly, what I say to my patients is if you see a therapist and you find that you're not connecting well, don't scrap therapy. It's really common to have to often try a few therapists before you find the right fit. And that's fine. It's perfectly fine. Medications might also be beneficial to help you feeling better. Not always, but oftentimes a low dose antidepressant can help with that anxiety or depression. I'm going to talk a little bit more about that seasonal affective disorder, and then we'll move into some coping strategies. But sometimes you do need that extra help if it's not going away. So seasonal affective disorder is a type of depression and anxiety that can last about 4 to 5 months, and it's pretty predictable. Usually comes on in the winter months. Some of the common symptoms might include that persistent sadness or anxiety and feeling almost empty. Patients of mine describe it as just a horrible feeling, kind of like a heavy, wet blanket is weighing you down. You feel fatigued and hopeless, and oftentimes a burden on your family. You have difficulty concentrating, remembering. And these, again, are pretty similar to what Susan talked about with symptoms of depression, but these are symptoms that don't go away. Oftentimes, you can even have thoughts about not wanting to live anymore or suicide. You can even have suicide attempts. And again, that is when you need to get extra help. And I'll talk about at the very end some easy to remember resources that you can access when you need that extra help. So let's get back to that seasonal anxiety through the holidays, maybe seasonal depression that can last through Christmas when it seems like everyone else is so happy. Do not slack on self-care. Sometimes you find like there's no possible way that I have time to do the things that I normally do that help me feel better. Don't slack on self-care. I'm telling you, if you continue with your normal routines that sometimes go out the window, you continue with them, you will feel better, you will be more productive. So normal routines lead to that decreased stress and improved coping. When you skip on those things, you can see your anxiety going up and having more challenges with coping. Take care of yourself. Susan mentioned this, try not to overeat or overdrink. Keep to an exercise schedule. Do whatever you normally do that keeps you healthy. So yoga might work for some, stretching, meditation, walking the dog, walking yourself, whatever you normally do, stick to that routine. And this is really cool because it's easy. You can focus on things that we're thankful for. And I'm going to tell you a little bit about a Duke University study, which I'm kind of fascinated by, because I think, how can this possibly work? But it's so well validated in the evidence, focusing on the 3 good things. And this is the study that I'm talking about. So Duke University did a study about retraining your brain. So our brains right now are hardwired to notice the negative, and that's on purpose, because back in the day, we needed to have our head on a swivel and noticing potential risks so that we could survive. But now that can lead, and we're finding that can lead to depression and burnout. So retraining your brain is as simple as focusing on 3 good things per day. And most people do that before they go to bed. But research shows that doing this for only 1 week, 7 days, can increase your happiness, increase your sleep, decrease burnout, and decrease depression. And we'll include this link in the follow-up email that you'll receive. But take a look at that, because there's all kinds of tools and apps that you can put on your phone now to remind you. And it's quite an interesting study. And it's pretty doable, right? This was a video. Ideally, we would just be clicking play, but for some reason it's not working. But it's about those impossible expectations. And we think for some reason that we have to do everything, right? Like we see it on TV, we see it on social media, and we must do this too. And this is a video of Chevy Chase in the National Lampoon's Christmas Vacation, I think it was, where he's working on his lights, remember? And it's impossible what he's trying to do. And we do that too. You know, we see all kinds of things and we're like, oh, I'm going to do that. And it's too much. So don't let those impossible expectations weigh you down. Some financial tips. And we think about, this, you think about all these gifts that you see everywhere and you think, oh, I might spend $20 on this particular relative. And then you find yourself trying to compete with what others are spending on their relatives, and it gets out of hand. So creating a realistic budget, thinking about how much you're bringing in, how much you're getting paid from your job, and how much you're spending on your bills. And then kind of whatever's left over is what you can use for extra, right? That's just that basic low-level budgeting. But some ways to save money, I'm talking to you in the middle of December, so this shopping early is a bit not super realistic. But, in the future, shopping early, using coupons, choosing that in-store pickup instead of the shipping right to your house, pros and cons, but it can certainly save you money. If you're currently in debt, you might think, well, what in the world is the point of having a holiday budget? But there is a point. Every little thing helps you from falling further into debt. So every little bit helps. Identify creative ways to celebrate without causing that financial impact. So making homemade treats, creating special decorations or crafts instead of buying them, shopping at garage sales, estate sales, thrifting. That's like super in thing right now, you guys. Like my older kids are, saying that's the way to go, which is kind of cool because you can also save quite a bit of money. And then prioritizing experiences over stuff. So planning a hike in the woods or cooking together with loved ones instead of trying to find that perfect gift. Scheduling a family drive to see some Christmas lights while sipping hot chocolate. These special moments will not only financially impact you, but it will also help create those long-lasting memories. So kind of killing two birds with one stone there. I'm going to skip that slide and then go back to it. So volunteering. Volunteering helps improve your mood. It allows you to feel healthier and increases your sense of purpose and also reduces your stress levels. So you might be thinking, seriously, she's talking to me about volunteering? I barely have time to get all my stuff done. I get it, totally get it. But volunteering helps you to be more productive by improving your overall sense of wellness. When you feel better, you tend to have more energy to get the things that you need to get done. And it's also sustainable. So volunteering can help in the immediate sense, and it can also produce just long-term sense of happiness and decreased stress. And on the previous slide here, you can Google volunteer match and a bunch of nonprofit organizations will pop up, and you can kind of sort that by the city that you live in. So this one is specific to Grand Rapids, this website, but you can look, you can kind of filter that in whatever city you live in. So it's a really cool way of finding some nonprofit organizations in your area if that's something that interests you. Or seeking that support. I talked about that earlier, right? When you feel the need for extra support, and honestly, that is really courageous. It's a really courageous thing to do, is seeking extra support when you need that. It's so tempting to isolate, but honestly, joining a social group or a support group that encourages the healthy habits that we had talked about, like walking clubs or some fun things like bowling or events at local community halls or local libraries, just any support groups which you identify with. And that'll help you get back to your normal routines that we talked about earlier of movement and exercise and eating right. And again, see your physician or your mental health provider, your therapist or counselor if you have one, if you need that extra guidance, or just check in with a friend. That can also be really helpful. So what to do when others are struggling? And there's a really cool link at the bottom of this slide, and we'll include that in a follow-up email too, from the QPR Institute. And QPR stands for Questioning, Persuade, and Refer. And it's a really cool training for suicide prevention. But this, honestly, what to do when others are struggling, there's really cool, easy things that you can do that will be helpful. Because I don't know about you guys, but sometimes when I see others struggling, I think, oh gosh, I don't know what the right thing to say is. I shouldn't even, help because I might say the wrong thing. But honestly, I'm going to give you kind of a little acronym to remember. And this is what I do is first, the first two, before I get to that. So I know you're sitting on the edge of your seats for this, but the first two things is encourage self-care in others. So all the things that we talked about today, you can encourage that in others. Be a model for others with your actions. Sometimes you need to support them in social situations. I know that for me, I'm kind of an introvert. So joining groups or going out and doing extroverty things is kind of intimidating for me sometimes. So maybe that is true for others, and you can be a support by joining in. It's so much easier, I think, with a friend or with two people as opposed to being the only one. And then being a good listener. This was the acronym that I was talking about. I use something called LEAP, LEAP, and it stands for listening. So that's the L, and it's so tempting, honestly, when somebody's talking to you and telling you about a problem, to attempt to jump in and try to solve the problem. Believe me, I get it. It's very tempting. Don't do it. Stop yourself, force yourself to listen, take it in, and then empathize. Empathize is really trying to put yourself in their shoes and saying things like, wow, that sounds really hard, or that sounds horrible. And that A is agree. So taking that empathy a step further and saying, if that was happening to me, I would feel the same way. That's so validating and so helpful to just validate how other people are feeling. And oftentimes that alone can decrease stress in others. So that's the LEA, listen, empathize, agree. And then the last thing is partner. So end that conversation with, what can I do to help? Instead of trying to jump in and offer great words of wisdom, start with those things first. Listen, empathize, agree, which is really validating feelings, and then partnering with them. The last couple of things on the slide, provide words of encouragement. So I just kind of went through that a little bit. You have to be careful with that because we don't want to be patronizing. But if you really try to put yourself in their shoes and empathize and validate feelings, you'll be pretty good. And then encourage them to seek help if needed, just like we talked about earlier. So you might be thinking, well, she said seek help if needed, but what, where can I seek the help? So these are some of the resources on this slide, and these are national resources. So you don't have to think like, oh, I live here, will it work here? 988 is the 911 for mental health concerns. You can call 911, but you'll be transferred to the clinicians that are monitoring the 988 phone line. So you call 988 anytime you're struggling with depression. If you're having thoughts about suicide, you dial 988. You can also dial the longer version, the 1-800-273-TALK. But the easier thing to remember is 988. You can press number 1. If you're a veteran, you'll be connected right to some veterans resources. You can also text. If you're a texter, and it's easier for you to text as opposed to talking, you can text 741-741. And that is a free 24-hour-a-day support line. It is the crisis text hotline. So those are a couple resources that are available all the time. Whenever you're feeling like you're struggling, please reach out for help. Those are our references included throughout the presentation. And I will turn this back to Brittany, and she will kind of navigate some questions. Thank you.
Thank you very much, Carrie and Susan. And before we get started with the questions, just as a reminder, if you do have questions, you may put them in the Q&A little speech bubbles down near the bottom of your screen. Before we get started with a few of the questions, Carrie, I'm not sure where your microphone is, but if you could maybe just get a little bit closer to it. There was a couple points. We could still hear what you were saying, but there were some moments where it was a little bit quieter. And I just want to make sure everybody can very clearly hear your answers.
Perfect.
So I am going to read the answers aloud, and then you guys can kind of handle them as you see fit. All right. And so getting started, just wanted to share that we did have a very nice comment that was, if we can't see something or if technology isn't working, it's okay. Remember self-care. Thank you for offering this session. So, but our first question is, and I think you covered maybe a little bit of this in some of your slides, but if you could maybe provide a little bit more detail. A few of these are similar in nature. How do you know when to ask for help?
Susan, you want to take that?
Yeah, absolutely. So I think, everybody's a little bit different, but generally, the rule would be if you're feeling depressed or not yourself for more than 2 weeks, it's time to reach out and get some supports. Generally, that's where we start to see that there might be some adjustment happening, some things going wrong for you, just not feeling right. You can't bounce back. Some of the things that you used to do or self-care techniques are just not working for you and you're feeling those symptoms. Reach out after 2 weeks, reach out for help and get some supports.
Yeah, and I think just to tag on to that too, I was thinking some people are aware that a certain day might be difficult for them, so they can even proactively plan to have activities scheduled for that day or a check-in with a friend if it's a particular day that's rough. So I think I've seen that strategy is helpful for quite a few people.
Our next question is, who do you contact for help?
So Carrie mentioned a few different resources to reach out. It could be that trusted friend, someone that you can call on the phone. But if you do feel like things are not turning around like maybe they have before, it's always really good to reach out to your medical professional, your provider, your nurse practitioner, or physician to get appointments scheduled and just check out things. There could be something medically happening that maybe you just think it's depression and it's about the seasons, but there could be also some good points by getting checked out by a medical provider to make sure that there's not something more going on. And then that medical provider can refer you to an appropriate counseling resource. I think we talked about social workers, professional counselors, psychologists, even, like some life coach support groups, are all really good places for you to get help depending upon your unique needs.
Thank you. There are two questions that are a little bit similar, so I'm going to ask both of them if that is okay. The first one is, how do you ask someone if they need help? And the second part of that, or the second question is there a right and a wrong way to ask someone if they need help?
Those are really good questions. A good resource to check out if people are interested is that QPR Institute, because that kind of gives you some examples of ways that you could ask questions. But it depends on what is going on. But I think that the first step is noticing that someone might be struggling. So that's great if you're doing that. And then just being direct and as empathetic as possible. So you can say, I've noticed that you seem to be having a hard time. Do you want to talk about it? And just be really prepared to listen. Because I'm telling you, I've been doing this a long time, and it is tempting to jump in and try to minimize, or, well, you have, this and this seems cool. But really it's that validating feeling. So listening when someone opens up, encouraging people to open up and talk, let them know that you're there anytime that they want to talk. And then say things like, if I were feeling that way, I wouldn't feel like doing anything either. That seems really hard. And trying to do that listen, empathize, agree, and partner method helps me kind of remember what I'm doing when I'm in that particular situation. Susan, anything to add on to that?
No, I think you covered that well.
Thank you. This one may also kind of go in that same category, but if someone is quote unquote losing control, how is it best to respond?
So I guess by losing control would mean really, couple clicks left of center from where they normally are. So that may be in a situation where you might need to intervene. They may need to be brought to an acute care center for an assessment. Maybe do a sort of check in with them about where are you at with things and how are you feeling and are you safe? Because if they're not safe, by definition, losing control, that would be something that would require more involved intervention, like getting them to a crisis center.
Thank you. The next question is, how can I get training in suicide prevention to help others?
Yeah, there's many trainings out there. The one that there's a couple that stand out in my mind, but honestly, the one that I've been most impressed with lately is the QPR Institute, because it's pretty intuitive and easy. It's not complicated, and it's not going to be super in depth that you need to be a master's prepared clinician by the time you're done with it. It's basic, and it is relevant for people in all fields. So you might check out that QPR Institute. The Mental Health Foundation in the Grand Rapids community has some really awesome resources too. Susan, I don't know if you have any other that off the top of your head.
Yeah, there's a Be Kind initiative that's it runs throughout Michigan that has some great talking points for people to intervene, to feel like you can gently express concern and support. And really, it's really just about identifying people that are struggling. And sometimes that's the hardest thing, is to really focus in the identification. But if you know people, or if you feel like you can, check in with people that may not necessarily make their struggles known, they're the ones that are they stuff it, and then all of a sudden it kind of blows over. So be that helping hand, reach out to that person, and utilize some of the different supports that we've noted.
Thank you. Couple more questions that are a little bit similar in nature. So if you don't mind, I will kind of ask them together. The first one is, what do you recommend for people dealing with unrealistic pressure from family members to help manage future holiday sessions? The second question is, how can one create boundaries for those that increase stress in life or undermine recovery?
Yes, great question. Super easy for me to say and really hard to do. But you do have to be respectful and direct about what's going on. So I think that it is easier nowadays. There's a lot of support for people advocating for themselves, right? So I think that it's perfectly fine to say, you know, when you ask me to do this, this, and this, I feel a sense of increased stress. So I'm not going to be able to do that. You know, and it's sometimes assuming best intentions too, while you phrase some of those things. Like, oh, I feel such and such a way when you asked me to do this, and I'm sure that wasn't your intention. But I just wanted you to be aware that I'm not going to be able to do those things. And then you have to somehow, and I don't know that I've mastered this yet, but somehow not feel guilty about doing that. Somehow being okay with setting those limits, setting those healthy limits. You don't have to say yes to everything. And it's perfectly fine to just calmly and respectfully say, I'm not going to do that thing because it's not healthy for me.
And I would like to add that, certainly using I statements about what I will and I won't do. I think that that's probably like the foundation to setting healthy boundaries. And I think some of the things we talked about is sort of pre-planning for the holidays, what that looks like. Some of my friends that have, their children are adult and they have children, they've decided that they simplify gift giving by doing that, draw a name, and they do that at Thanksgiving, and that's what they do for their Christmas, so that they set some parameters around what they will do and not do, so that they don't feel like they have to buy for, every aunt and uncle, every cousin, every niece and nephew. So it's just really sort of pre-planning and setting those limits. And of course, it's easier said than done as we're talking to you on the 13th of December. But you can set those limits even now, just to say, nope, I've done enough, or this is enough, or looking at, that special message in a card versus, buying that person a gift. And again, it's easier said than done, but we're all in the state of becoming what we want, right? So we can take little steps to achieve that desired outcome.
The next question is, do you have helpful hints to handle situations where you and your significant other have different expectations?
That's a good one. I was going to say, no, just kidding. Yeah, similar to, I think, and Susan can jump in here too, because this is she's the master's prepared social worker. I'm the psychiatric nurse. So if you have any medication questions, I'm your girl. But I think it's real similar to that respectful limit setting with others. I wouldn't use those words directly, like, hey, I'm going to be setting limits with you, but just talking respectfully about, I feel this way with this particular plan. Can we talk through that a little bit? Just for my own personal health. And I think that having those direct, respectful conversations go a long ways. You have to just personal experience, time them accordingly. So when you're feeling particularly stressed and irritable, probably not the best time to initiate that conversation. So it's okay to wait a little bit and then plan for that conversation intentionally.
Yeah, and I think really important is to continue with like a family meeting or a couples meeting schedule to talk about things that that are upcoming and what are going to be each other's expectations for the other human related to that particular event or that family celebration, and looking at ways that you can back each other up around that, and being respectful of when one person is feeling like they can't continue on that same path with that particular level of intensity for that activity, to say, I have the right to say, I need to tap out of this situation right now. That's not something that I can do. But if it's really important to you, I can support you with, X, Y, and Z to still have, that event happen or that occur. It's just about dividing and conquering when it comes to the stressors around family and events and activities.
Mm-hmm.
Thank you both. The next one, it sounds like they have a family member specifically that they're referring to. What if the person you're concerned about is a social worker themselves?
Okay. So this is, encouraging that clear and open communication about and observations about what the behaviors that you are seeing about your family member that's a social worker or friend that's a social worker, and cling that to, I'm seeing you, not feeling the same level of joy that you felt, a couple months ago. I'm seeing these activities, not bringing you the same amount of joy. I'm seeing you very stressed out. What are some ways that you can reach out to get some supports for yourself? And most companies, organizations, even especially within the social work realm, have some sort of employee assistance program or supports that they can reach out to. And so again, it's that providing that support and listening ear to say, I'm seeing this, you can talk to me about this, but I do think you need to seek some help.
Mm-hmm.
Thank you. The next one is, in the instance that someone reaches out to their provider and has to wait several weeks to get an appointment, what are some other options?
That's a good question. Yeah, unfortunately, I think we do see that quite a bit, that longer wait time. I do think that those texting hotlines are helpful. The 988 number is immediate. There's community mental health agencies. There's emergency departments. So if you're feeling desperate and really in need of immediate attention, there's quite a few resources out there. We are in the process, just in the West Michigan area, of standing up a behavioral health crisis stabilization center. So then that would be someplace you could go to seek therapeutic intervention immediately, which isn't really all that common right now. But I think if it's moderate symptoms and not to that crisis level where you would need immediate attention, it's all of those things that we talked about in the PowerPoint today. It's connecting with family and friends, asking for support. Sometimes it's just helpful to talk with someone informally. That those self-care activities, the volunteer opportunities, some of those things might help you get through until you can see a therapist and talk and come up with a plan more formally. But again, don't forget those immediate resources that are available too.
I would also like to say that we have a lot of options for virtual talk to a doctor, or even MyChart messages if you have an established provider. This is why we always make sure we get established providers, because you never know when you might need help. but reaching out to your doctor via MyChart or calling the office and speaking to a triage nurse, that information can go to the doctor and they can certainly make some recommendations. I know in offices where we have behavioral health supports, if you can reach out to that provider, they may refer you right to the behavioral health support. You might get to see somebody within a week within an office, or at least be able to communicate and get a referral and get some resources. And we do a lot with MyChart messages and can be able to send a lot of helpful tips and hints like you're going to get today in this presentation, but also, specific to any condition that you might have.
Thank you very much. And then just a quick reminder, because we did get a question about this, that this presentation is recorded and it will be provided to everyone in an email, and we will also include many of the resources that Carrie and Susan mentioned today. And with that, I have a question about resources that are available to support individuals for things not related to suicide.
Yeah, honestly, all of those resources can be accessed for other mental health issues, anxiety, depression, racing thoughts. It's not only for suicide. So all of those things that Susan just mentioned, reaching out to your primary care provider, getting connected with a therapist, calling those crisis lines for anything. Honestly, it doesn't have to be only suicide. It's mental health is mental health. There's a lot that goes into that. All of those resources would apply, in my opinion. Susan?
And actually, someone had, just reading ahead on the questions, but someone had put in there their spring health benefits. So that is Trinity Health's employee assistance program. And you get a certain number of free sessions with Spring Health. I believe it to be 5. Don't quote me on that. And family members also can reach out to Spring Health and get that benefit. So you can, there are links on SharePoint, as well as always reach out to like HR4U to get more information about how to access those services if you are an employee of Trinity Health.
Thank you. And we do have a couple questions related to SAD. And the first one says, I've recently been having trouble sleeping. Could I be suffering from SAD?
Could be. It's really with the seasonal affective disorder, it's the persistence. The symptoms just don't go away, and they linger for 4 to 5 months and then seem to get better as the weather improves and the sun starts to come out. So it's pretty predictable. But I don't know that you have to worry so much about the diagnosis. If you're having trouble sleeping and it's impacting your ability to function during the day, seek help. Connect with your primary care provider and talk to them about that. You do not have to worry about, is this diagnosis or that? Impaired sleeping is horrible. It is horrible. So you might want to check into getting more help for that. And it might be an anxiety issue that's causing the sleep disruption, but then professionals can kind of help you work through that.
Sleep hygiene is really important. I think that's it can just spiral and make depression, milder depression, anxiety so much worse. So really putting that phone away, turning the TV off, giving yourself that opportunity to unplug and recharge before you go to bed, because we're seeing that screens really exacerbate sleep issues and just cause more problems. So really working on the sleep hygiene, no caffeine after a certain amount, certain time of the day, whatever it is that might be impacting you. But sleep hygiene is so important. Sleep regulates so many different things, and it's really important.
Thank you. And what is your opinion on light therapy for treating SAD?
I've heard really good things about it. I personally have not done it, but I do know people that have, and they really swear by it. But obviously, it's got to be something that works for you. It may work for you, it may not work for the next person, but I've heard very positive things about light therapies.
Mm-hmm. Me as well.
Thank you very much. I am just trying to scroll to our next question. And who can prescribe mental health prescriptions?
Yeah, so physicians can prescribe medications. So your primary care doctor often prescribes those lower dose antidepressants. I'm not a huge fan of anti-anxiety medication. They're pretty addictive and they're really supposed to be used for very short-term fixes. But low dose antidepressants can help with anxiety as well. So that's often prescribed right in the primary care office. Psychiatrists can certainly prescribe psychiatric medications for all kinds of reasons, for mood instability or thought disorders or depression or anxiety. Trying to think. There's a couple other roles. Clinical nurse specialists can write prescriptions, but for the most part, psychiatric medications are prescribed by your primary care provider, so PA, NP, PCP, or psychiatry providers. Is there other mental health professionals, Susan, that you're aware of that prescribe meds?
No, I think you've covered them all, unless you mentioned PsyD. PsyD, some of the PsyD's psychology with have some prescription writing privileges, but for the most part, it's going to be primary care and psychiatry.
Thank you. We are going to do a couple more questions as we're getting close to the end of the hour. The next one is, you've mentioned a lot of support for people who are willing to advocate for themselves, but what if they won't or don't recognize that they are struggling?
So frustrating because we want to fix, we want to fix, we want to fix. I think personally that is when we have to recognize that we can't control everything, right? So you do your part to notice and be a support for the person that's struggling. You know, make it very obvious that you are there as a support. But you ultimately can't control others' choices, right? So sometimes people aren't ready to accept help, and that's really hard to watch that. If a person is not accepting help to the point of being unsafe, so you feel like the person is suicidal and at risk of harming themselves, there are things that you can do to force treatment, but that's generally not recommended, right? That is last case resort if a person is really at risk for harming themselves. But it is tough. It is tough to watch and feel like you're doing all these things that you can to be helpful and watch a person just not be ready to accept that help. Susan, any tips or advice for that?
Yeah, I think just being reassuring to them and say, you know, I recognize you're not ready, but I will be there for you. I'm here for you if you need me and when you are ready. So, and that's just really good guidance for a variety of health issues. Might it be depression, anxiety, substance use disorder. Just saying that I'm there for you when you're ready to take that step.
Thank you very much. Next question is, do you have an app or a website that you would recommend for meditation?
I'm glad you asked this because I was looking this up. So I like, there's one called Calm, which is a sleep and meditation and a rejuvenation app. There's also Better Sleep and some white noise apps like Rain Sleep. Actually, Google Marketplace or the iPhone store, whatever store will give you a lot of options if you just Google meditation and sleep apps. So there's some really good ones out there, many of which are free. Don't pay for that. You can download that for free.
Yeah, we use Headspace on the inpatient psychiatric unit with some of our activity therapy groups. And the activity therapists and the social workers are huge fans of that app. The staff use it, patients use it. That's great. And they have two options too. They have a free option, and then of course, just like with anything, you can get fancier and then pay more, or you can just do the free option.
Thank you. And it looks like someone else did share that if you just ask Alexa to play soothing music, she will help with that as well.
There we go.
There you go.
And if it's okay, I think we will do one last question, and then any questions that we did not get to, we will include a frequently asked questions in our email. That also goes for if anybody did not feel comfortable submitting a question at this time, and they would like to submit a question to the email that was associated with the registration. If you do so by the end of the day today, we will include that question in our frequently asked questions that goes with the follow-up email. So the very last question that we're going to ask, and this kind of goes along with the conversation that we had a little bit earlier, it says, how do you navigate around family members that seem to have control issues and will target random conversations and blow up? These are conversations that are general, not personal conversations.
Yeah, I think that is a good opportunity to practice your limit setting skills. So how do you set, because the way I see it is, we can only control what we can control, and that's usually ourselves and how we respond to things. You don't have to participate in difficult conversations with people that are going to stress you out. That's your choice, right? Whether to participate or not. And it's so tempting to want to change other people so that they act in a way that we feel is appropriate. Forget about it. You're just not going to be able to be all that successful in my experience. But you can certainly choose whether or not you participate in stressful conversations or when people are getting agitated. So you can say something like, it seems like you are kind of worked up. Totally get that. But sometimes I find myself getting worked up when we're having this conversation. So I'm going to go ahead and, do something, go talk with so-and-so for a few minutes. I'll touch back in 10 minutes or so. You can certainly say things like that. Susan?
I always go back to some of the one-liners from parenting and love and logic parenting training, but I care about you too much to argue right now.
Love that.
Yeah, just some one-liners that kind of diffuse, and they're like, but wait, I want to argue about this. I care too much about you right now to argue. And you just kind of diffuse the situation. And really, it just goes back to the limit setting.
Well, thank you both so much. That will conclude our question and answer session. Thank you to Carrie and to Susan for a great presentation and an excellent question and answer session. We really appreciate it. And we would also like to thank everyone that joined us this afternoon. We hope that you have a wonderful holiday season, being able to use some of these tips and resources that we've learned today. And we hope that you will join us for future Wednesday Wellnesses in the new year. Thank you.
Thanks, everyone.
Bye.